So welcome, and I'm James Younger, the founder and CEO of TempStars, and welcome to what I hope is sort of an ongoing series of interviews with thought leaders, influencers, business people in the dental profession. And I'd like to welcome Kathleen Bokrossy from RDHU. So welcome, Kathleen.
Hello. Thank you so much for having me. I'm excited.
So Kathleen, when I reached out to you about doing this interview, I know that you just know a lot of hygienists, and running your RDHU continuing education facility. I know you've got a really good finger on the pulse of sort of the dental hygiene profession and the dental profession overall. And I just wanted to kind of check in with you to see sort of how things are going, adjustments you've made, feelings you're getting from hygienists, and maybe what the future might look like when people are starting to get back to work and that sort of thing. Maybe start off just telling us a little background about yourself and RDHU and
Sure.
what it's about and how you started it and that sort of thing.
Sure. So I'm a dental hygienist, and I have always been an entrepreneur. I started a company many years ago, which was a dental instrument company. And so I would, we had our own instrument line, we did instrument maintenance services. And I guess what happened was I was starting to do a lot of presenting, helping people with their sharpening, with their instrumentation techniques. And I often heard from people that they love that type of learning. So they're always saying, like, could you teach us other things? Could we do other things that were hands-on? So at the time I was thinking, I was pretty well busy. I had a very successful dental instrument company that I did sell, I guess, 8 years ago.
Okay.
Yeah. But along the way, I just wanted to figure out how we can engage more people with the hands-on approach to education, because I was going to a lot of seminars where I would be sitting in a room with 200 other dental hygienists and never really came out feeling like I really got anything out of it.
Which is fair, because a good part of dental hygiene is clinical skills and hands-on things. The theory is fantastic, but you can only learn so much without the hands-on component as well.
Well, that's the thing is, and at the time, like, I've had RDHU now for 11 years in January, but there was nobody doing the hands-on. So we were the first to actually have a hands-on facility. It was just mostly lectures. So it was a great opportunity to really implement that into our practice, into our skills. So really just started by doing that. And then from there, we started to do online as well, because we often have people ask, can you come and do RDHU over here in this province and that province? So yeah, so then we started doing online education, and we have the Dental Hygiene Quarterly as well, that we have a lot of people from Alberta, BC, and the East Coast on that as well. So they get 12 hours of CE every year.
Right.
And but we're not just about, I think the thing that makes us so different is that we are focused on more than just that webinar, more than just that course. We really talk about, so what are our goals? So in Ontario, we have to have our learning portfolio, same as BC. So we have to set goals for our practice. So we do a self-assessment on how can we improve our practice.
Right.
And then so we look for things that we want to focus on that year. Our college can give us some guidelines for our goals, but we can also create our own. So we help people set goals for themselves for that year and help them create a learning plan. And then during the learning, while we're in with the courses or online or however we're doing it, we sort of reflect on, okay, so what did we learn in this, and what can we put into our learning portfolio? And then we reflect on how can we improve our practice. So I think it's a great system. I always think that, if you take a course and you can get a little bit excited and then you leave and there's been no change, like that's what I don't want to happen, right? So we kind of look at the future and what can we implement into our practice to make change happen and to make things better for our clients, our patients, and for ourselves professionally as well. So we are like a complete package for for everything professional development.
Nice. Maybe you could just talk about your recent transition in terms of what's been going on with the coronavirus, and I know there's really no in-person hands-on training, and that was sort of one of your areas of expertise.
Yes.
So tell me a little bit about that transition and how you've sort of made the shift from providing online resources and remote resources and things like that.
Right. So we take the summer as our time to really get prepared for September. It's like a new year for us.
Mm-hmm.
So we started off in September. We had a great September, October. And then Thanksgiving weekend, I slipped at our cottage. They lower our lake. And I slid down our ramp in the morning on Thanksgiving Sunday morning.
Wow.
I hit ice. I didn't realize it was a frosty morning, and my foot stopped at the dock, and I kept going. So I dislocated my foot. It was facing the other way. I shattered my ankle. I broke my leg. So yeah, so then I have a fantastic team, and they came here, they helped me. It was a trying time, so I've been isolated really for 6 months.
In terms of courses you had scheduled, how did you manage that? Because I mean, you would have a lot of courses coming up. Were they rescheduled? Were they canceled? Or were they just delayed?
We had so many things set up. We were working with oral science as well, and doing this event across the country with Beth Ryerson, and we really had to reinvent ourselves. And when I look back, I've been through so many situations in my business life. I've had a lot of adversity in my career, in my path. So I feel like that's why I am okay today. I've gone through those things, I've survived them. So when all this was happening, I was just like, okay, what do we have to do? Because I'm not a quitter, I'm a survivor. And here I am thinking, oh my gosh, I'm in isolation and I have a cane. It's kind of like, what's happening?
That's a double whammy.
Yeah. So now I'm not on my cane. I dropped that a few weeks ago, and just really reinvented our business. And we had, like I said, we've got such a great team that everybody jumped in, and we all have different roles now. So all of those courses that we had that were going across the country are now being offered live. Yeah, even our laser programs. So what we're doing is we're going live. Like, let's take advantage of this time that we're home. And then when it's time when we can get back together, we're going to do the hands-on portion of our laser training. Yeah. So yeah, we just really reinvented ourselves, and we're getting great feedback from our members. They love it. And most dental hygienists are not comfortable on the computer. So there's a lot of people who are worried, I don't think I can do it. It's not for me, but we just say, give it a try. And we've got some great positive feedback, and we can even break off into their own breakout sessions. Yep. So we're still having that. It's not like you're just going to be sitting there listening. You're going to be participating. That's all that RDHU is about. It's like, tell me and I will forget. Show me and I might remember. Include me and I will learn and truly understand. And that's really what we stand for. So it's not just about that course. It's about being involved, participating, and really deepening your learning so that you can actually grow as a professional, grow as a person, grow your practice. Because I'm a big believer that if we're not being engaged and we're not learning, that's not a happy life, right? It's just, you kind of just drift in your life then. And so that's really what we're doing. And we're busier now actually than we even were before, which is really unbelievable. But we have got tons going on. People are using this time to work on their continuing education, to keep connected, because, I feel like, the doors might be closed right now for you, for your office, but you can still grow as a professional. You can still grow your practice. You can engage with your patients, with your clients. You can nourish those relationships. So I'm actually having a webinar on Monday at 2 p.m. For people that want to hop on with their dentists, office managers, assistants, get everybody on there. I have a whole presentation I'm going to give everybody so that they can use that presentation. They can tweak it if they want, but they can use that presentation for their own patients, invite them online, go through this presentation with them. The last thing you want to do is be disconnected from your patients. Life has changed for us as we know it, and we have to evolve. We can't get stuck. We have to keep changing, or you get left behind.
Yeah. Now,
Yeah.
have you heard anything? Have any of the licensing colleges made any accommodations in terms of auditing or things like or CE requirements with
So
this? They put that on
um,
pause or give leniency to people who need to
I
get
think
audited, that kind of thing?
I think the dentists have. I remember seeing something because they have to do some hands-on with hygiene. We don't have to do a certain type of learning, so we can do our learning online. We can read articles. We can read, you know, read textbooks. So as far as I know, everyone's using this time to do their CE, and I
Right.
deal with almost all the regulatory colleges across the country. And we have like different, every college is different for their
Mhm.
different needs. So as far as I know, everyone's still working on their
Still on track
CE.
for it. Yeah.
Just the people that were audited and submitted in January, which is myself and my colleague Beth Parks as well. We were both audited and submitted in January. We coach people, like that's a big part of our business. We
Mhm.
walk them through the whole process. We do screen sharing. So all of our people are now waiting until the fall. So that's
Right.
being put on. We won't know the results until the fall. But for
Right.
those who
Right.
are submitting in 2021, I
Mhm.
think we're still on track,
Yeah, I see.
which
Okay.
is which is good because really when you're at home, why not? Like why not take that time? There's so many resources out there. Um, and take that time and just invest in yourself and feel good about our profession and about going back, you know?
Well, and keeping your brain active and thinking and learning too, for sure.
Yeah, for
Yeah.
sure.
Now, you and I were talking earlier, and nobody knows for sure, but we were sort of bouncing around ideas of what back to work might look like. And
Hmm.
I know everything is sort of rumors and conjecture. There's been no confirmation. Nobody even knows when dental offices are opening again and what that'll look
Right.
like when they do. But I hear things back and forth that might just be suggestions or rumors or things like that. But maybe tell me a little bit about what you imagine sort of the early and mid days for dental hygienists getting back into practicing at dental practices. And even, I guess, on a two-pronged approach, I mean, certainly independent dental hygienists and opening up their businesses again.
Hmm.
And then also as a dental hygienist working within the team at a dental office. What are some ideas you might have that it might look like as people might be going back?
That we might be going back. Well, I think we are experiencing big change, right? So there's going to be change in the environment where we're working. Um, what that looks like, I can't say exactly, but it's going to have to do with air quality, water
Mhm.
quality, aerosol,
Aerosols, yeah.
yeah, suction. There's going to be some big change with all that. And I've heard of, we'll slowly get back because we also have to build that trust with our patients as well and get
Mhm.
them to want to come back. So that's part of the whole thing I'm talking about Monday. It's like, what can you do to make sure that you're nurturing those relationships, that you're building that trust, because you want them to trust you, that you're for them to come back,
Mhm, mhm.
um, and then I do think it'll probably be like a slower return. I don't think we're going to be, oh, we can all go back and then we're all going to be working. We have to rebuild that schedule. And again, that's why we can't let this time, you can't be on pause 100%. We have to
Right.
keep working and we have to keep building and planning as far ahead as we can, um, and staying connected with our patients.
Well, and definitely, I think, and I don't know anything for sure because nobody does, but I imagine there's going to be scenarios where the capacity of the office will be reduced or the operatory turnaround time will be reduced. So just the overall patient capacity on a daily
And
basis will be
you know,
lower, I think,
I
in the
do
early days.
so the thing is, things are going to change for a while until we get this under control.
Mhm.
I think back when I was taking dental assisting in the 80s. I remember that was just when the AIDS virus was hitting, and there was a whole fear for the dental professionals and for the patients, right?
Mhm.
So there was so much change. I remember that. And I think what's going to happen is things are going to change big time. we're going to adapt. We're still going to have our jobs. We're still going to have our profession. People still need us, right?
Absolutely.
And then we're just going to continue on. It's just going to be a slow start, but we're not the only ones that's going to be a slow start. It's going to be a slow start for, every business, right?
Yeah.
Ours will be a little bit different because of the airway. We have the nasal, the mouth, all that is like, it's right where the COVID-19 starts, right? So we have to be super careful, but we're just going to have to follow. There's going to be no more resistance from offices that say, oh, we're not going to do that, or we have to create a safe environment for our teams, for our patients, and then I think we're going to continue on.
I think one of the things too is, when you have hygiene patients on 3-month recalls and you're emphasizing to them the importance of these recalls and staying on top of things, and then they kind of fall off the wagon, I think there's going to be a big oral hygiene instruction component and reconnecting with patients, because maybe it'll be 6 months before they come back and they think, oh, I didn't come. It's
going to be a mess.
That's fine. So, and they will be a mess, but they might not even be aware of it, I guess. And so I think that's
oral hygiene is so important. And that's what I really want people to stress with their patients. Like, now's the time. So there's so many things we have to do right now. And it worries me that people who have a compromised health situation, that they're not going to be seeing us, and for how long. So that's why I really want people to get in touch with their patients, stay connected with them, help them, drop things off. So many of us kind of just manage disease. And every time they come in, it's the same. We have the blood, the inflammation, the biofilm. And so we're just managing this disease every time they come in. And that has to change. That has to change. They have to take control of their own health at home. And that's where I think there's going to be a huge shift, in my opinion.
I think it will be. It will need to happen. And, maybe those N95 masks will be the new norm too for people to be wearing, and the face shields. And do you want to give people just a brief overview of, I know you're sort of offering a blend of these free resources and webinars and video resources, as well as some upcoming actual courses to purchase admission to and things like that. Do you want to, just so that people have an idea of what's coming up on your radar in the next
we got lots of
6 weeks? Yeah.
So, okay, we have a show called the RDHU, sort of taken from the talk show The View. And so we have Anna Louise Tolan, Beth Parks, Carrie Lepacek, and myself. So we're like the cast members. We always have a guest where we can interview them about certain topics. And then so it's very much like The View format, but it's also educational. We have learning objectives, short quiz after, and and then we have the certificates. So so we had Chrissy Ford on a couple of weeks ago talking about laser therapy, because we see that as being a huge thing that's going to be implemented in the dental practice when we do get back. We had Gina Bailey from ODHA. She came on with us twice to talk about employment issues. On this Friday, we have Joanne Jones. She's one of my best friends. And we're going to be talking about oral cancer screening. It's Oral Cancer Awareness Month. So we're going to have her on, which is going to be fantastic. And then we have her scheduled for a bunch of Fridays. So it's like Fridays with Joanne. And we have a bunch of courses booked with her. Uchi Odiatu is coming on as our guest. That is one of the free things that we offer, and everybody sort of volunteers their time. And what else do we have? We have so many courses now that are coming. The ones that were planned for a 6-hour day, we've broken it up and do 2 hours at a time over 3 days, because it's a lot to sit in front of a computer for 6 hours.
And you were mentioning, so some of the online ones, in terms of courses, some of them you need to be there sort of live, and you've broken up into live, and some of them are sort of available for viewing at your leisure as a video type of thing.
We have tons. We have so many that are on there that are pre-recorded, so they're all available. And then the Dental Hygiene Quarterly, to me, that is like the easy button. And that is something that you sign up. It's $149 if you're a CDHA member, $199 for a non-CDHA member, but you get 12 hours of video-based CE, right? Then And then I create an activity page with a goal sample, put the bibliography in there for you,
Right.
find extra resources. So it's a nice goal package that people can take and put into their learning portfolio. So,
Okay. Awesome.
so that's our whole philosophy. We are the easy button. I wish every company was the easy button.
Right.
I believe in that. Like whatever business anyone has, they should look at what would a dream come true experience be for my practice. And for me, like I dove into marketing back in I think it was 2012.
Mm-hmm.
And I started following this podcast, and Dean Jackson's become a very good friend of mine, and Joe Polish. So I follow their system, and it's called I Love Marketing, the podcast, and it's amazing. And they really taught me to look at your before unit. What does that look like? The during unit, and then the after unit, right? So right now for dental patients or for dental offices, we're looking at the after unit. So how do we stay connected? And it's just such a nice way to think about your business, to think about your practice, to give value. So giving value, not looking at every cent, right? What can I give people for free? That's a big part of it, right? You're growing a loyal base, right? People, and the opportunities are there for the dental office. Just because we're not there doesn't mean we don't have to do business.
Right. And I think a lot of offices no, I'm not going to say a lot. There will be some offices that may not make the full effort to stay connected with their patients, which is a shame, but at the same time leaves the opportunity open for the hygienists and dentists and office managers and the offices who do want to kind of reach out and maintain that constant connection and really kind of stand out in this environment as the ones who care about remaining connected with their patients.
Right.
Yeah.
For sure.
Yeah.
And there's lots you can do. So I think it's important. You need to stay connected. Yeah. And you need to educate.
Yeah. Nice.
Yeah.
Well, any last thoughts? I mean, I'm really thrilled to have spoken with you. And there was a few things that we touched on that I was like, as I was hoping to. And one is your sort of the attitude of keep going in adversity. And it's that idea of when I mentally think about challenges in business and things like this happening, it's sort of like if you watch an ant and you put a stone down in front of an ant, the ant doesn't come to the stone and say, I'm stuck, I can't go anywhere. It just kind of, maybe it'll feel the rock for a second, then it either goes over it or around it, and it just keeps going where it's going.
Right.
It's sort of that idea of there's going to be, hopefully not anything like coronavirus again, but there might be, or there might be other things, and the idea of assessing the situation, adapting, and you just keep rolling forward as best you can in the environment you've got.
That's all we can do.
Yeah.
And just keep a positive mindset. Like that's the key. And go for a walk in the morning, do some fitness. You feel so good when you do those things, and read lots of good positive things. Yeah. Just keep growing, and this too shall pass, right?
Absolutely.
Yeah.
Well, thank you for being with us.
Well, thank you for having me.
Kathleen Bokrossy from RDHU, and your website is rdhu.ca.
Yep.
And so
RDHU. I was going to say rdhu.ca. And if anyone wants to join us on Wednesday for that webinar, like the dental practices, it's rdhu.ca/COVID plan.
Okay, nice.
And that's Monday at 2:00. So you can just go on there, just fill out your information, and then we'll send you the link to join us on Monday.
Fantastic.
Yeah.
So this has been Dr. James Younger, founder, CEO of TempStars. And just so everyone knows, and if you're new to me through knowing Kathleen, so TempStars is Canada's largest and #1 rated dental temping and hiring service. And our placements are on pause while offices are closed, but we're still working hard. We're ready to hit the ground running as soon as everybody is ready to get back at work. So that's who we are. And thanks, Kathleen. And I'll talk to you soon.
Okay, thanks, James.
Okay.
Bye, everybody.
Bye.
Thank you.